Hey, Gray Steel Nation, Sully here with the Barbell Prescription. Got another board shorts for you. This one's been requested by some of our subscribers and Patreons, especially our very generous Patreon, Denny Champagne. Hi, Denny. And people have asked me to talk about Sciatic and Pyriformis Syndrome. This is a big topic. We can't really get too far in the weeds here. My purpose today is to sort of give you a brief review of what it is, what causes it, symptoms, overall approach to diagnosis and treatment, and why, if you are afflicted with this, you should not lose hope. You are still going to be in the game. What is sciatica and piriformis syndrome? Well, it's something that aggravates the sciatic nerve, which is the largest nerve in the human body. It's a big old sucker, runs down the back of your leg, and irritation of this nerve, or one of the roots of the nerve, can cause shooting pains, numbness, tingling, weakness. It's kind of a bastard. So how does this happen? Well, let's start with a little bit of anatomy. And so here we have a little bit of lumbar and pelvic anatomy. We're going to be looking at it from the front on this side and from the back on this side. And so here, if we look at things from the front, we see the L4 through S3 roots combining to make up the sciatic nerve trunk, which goes down the back of the thigh. And anything that irritates either this nerve trunk or any of these nerve roots coming out from between these intervertebral discs or through the sacral foramina can cause a sciatica-like symptom. So let's go ahead and look at the causes, and that will involve a little bit of additional anatomy over here. And so here we have sort of a Dr. Seuss rendition of an axial view of a lumbar vertebra. And so we see we have the spinous process here, the transverse processes in the lamina, and the vertebral body itself, which is the major weight-bearing column of the vertebral column. And we have the spinal canal. And we can see here dominating this surface of the vertebral body is the intervertebral disc, which has two main components: a soft, squishy nucleus pulposus surrounded by a tough, fibrous annular capsule. And in the spinal canal, running up and down the spinal canal, we have the great big nerve in the middle. You're really not talking about spinal cord, you're talking about the cauda equina, but that's in here and there. The nerve roots come out on the sides here, on either side. And so I think it's pretty easy for you to see how any sort of structural lesion might result in compression of one of these nerve roots, right? So, for example, we could have an osteophyte, like from arthritis, that might compress that nerve root and irritate it, right? Or we could have a herniated disc, which causes the nucleus pulposus to sort of herniate out and compress that disc, right? And this compression is thought to be not just a mechanical irritation of the nerve root, but also a chemical irritation to the nerve root. And so there's a long list of things that can cause this sort of irritation: osteophytes, bone spurs, herniated disc, tumors, and other sorts of lesions, sitting, and other stuff, right? But remember, you can also irritate the nerve trunk itself, the actual sciatic nerve trunk itself. So let's go back over here to this part of our anatomy and look at how that happens. And so if we look at that anatomy, we find that deep to the gluteus maximus, we have a group of muscles, the external rotators of the thigh, which originate medially and come out and insert laterally on the greater trochanter and related areas around the femur, so that they can pull out your thigh muscle. These are muscles that help you go knees out when you squat. And so really what they are, if you think about it, is the rotator cuff of your ass, right? So gluteus medius, piriformis, spiragonalis, obturator internus. And I think it's pretty easy for you to see how, if this nerve root, which we're looking at from the front here, coming out into its, all these little nerve roots combining from the sciatic, we can see how this trunk, as it emerges from between the muscles of the rotator cuff of your ass, could get squeezed between two of these muscles. And we think that that's what's happening in the piriformis syndrome. Piriformis is tight, or the piriformis is swelling, or if you've been sitting on it and irritating the tissue around the piriformis muscle, how you get compression or some sort of irritation of the sciatic trunk as it emerges from between these muscles and goes down the back of the thigh. And so that's where you get into trouble. And so what happens? Symptoms that you're going to get from this are going to be unilateral. It's unusual to have bilateral, especially with Piriformis syndrome. Unilateral shooting pain, burning pain down the back of the leg, associated often with low back pain, glute pain, weakness, paresthesias, and so forth. And the differential diagnosis for this kind of symptomatology goes beyond sciatica and Piriformis syndrome, so you're going to want to get checked out. And getting checked out means what? Well, it means preferably a good history and physical examination, which I'm sad to say is rapidly becoming a lost art in modern medicine, supplanted by imaging, which is certainly not a lost art. Certainly billing for imaging is not a lost art. EMG and other sorts of diagnostic maneuvers. And what about treatment? Well, treatment, as always, they're going to say rest, don't lift anything. And actually, in the initial stages after a diagnosis of piriformis or sciatica, rest is probably a good idea, although you're not going to revert to complete immobility. You're going to continue to walk and try and move around as tolerated, right? Ice, heat, if it helps, usually ice is better. NSAIDs, absolutely critical. Acetaminophen, absolutely critical. You want to keep your pain on a short leash. Physical therapy, if you have a good physical therapist who knows what they're doing and who knows who you are, an athlete of aging, that can be critical. Massage helps some people. TENS, basically electrotherapy. When things get stubborn, injections with lidocaine, marcaine, steroids, even Botox help some people. And then in really rough cases, surgery, or in cases where the surgeon needs to put his kid through college, surgery. So make sure that you understand that surgery is not a desirable option in these cases. It is a final heroic measure, and it doesn't always work. In fact, the literature on surgery for sciatica and Piriformis syndrome is pretty sucky. It's the outcomes are not great here. What's the prognosis? It depends. It depends on lady luck. It depends on your genetics. It depends on the particular anatomy of your case. It depends on, like, is it an osteophyte? Where is the osteophyte? Is it a herniated disc? Is it a tumor, right? Is it a nerve root problem, or is it a sciatic trunk problem? And so on. But in general, the prognosis is pretty good. We've seen a lot of cases of this. My colleagues have seen a lot of cases of this. And people do come back from this. The people who keep moving, people who keep working at the edge of their range of motion, the edge of their discomfort, finding out what movement patterns can be trained and training those movement patterns until this gets better with appropriate analgesics and physical therapy and massage and stretching and whatever else it is that helps you, right? And really the take-home message of this board short today is not any particular prescription for your case of sciatica or piriformis, because I can't do that over the internet, and nobody can. Nobody should, right? You have to work with your doctor and your physical therapist and your massage therapist and your coach, right, to work through this, and it will take time. But you will come back from this, right? People do it all the time. Yes, it sucks. It can be really, really nasty. And there will be, dark nights of despair while you're working through it. But one day you'll look back and you'll come through this. So whatever you do, keep moving, stay strong, stay healthy. I hope this helped, and I'll see you next time. Thanks for watching.